Started?
Yeah. So, good morning. I'm Dr. Raji Duraswamy. I'm a doctor of physical therapy and I'm the founder of Physical Therapy and Wellness. And we've been around for 34 years. And in these 34 years, I've had the privilege of helping thousands of people overcome their physical problems, be it, back pain, sciatica, shoulder pain, rotator cuff pain, neck pain, balance issues. So what I realized over the course of time is that, there's a lack of awareness in the community and the general population, where people are not aware that physical therapy is a great avenue for treatment of these conditions. And people just unnecessarily rely on medications, injections, and surgery for all of those conditions, including, balance and vertigo issues. So basically, my team and I, we decided that, let's try to hold these workshops so we can make people aware that this is an option. Try this before you, give up and think that, oh, nothing's helping me. So we started doing these workshops and we've been doing them for about a year or so. Of course, with COVID, a lot of them were done virtually, but we're starting to do them again in person. And so I do want to thank you all for coming. And I hope you find this informative and helpful to your condition. So I would like to introduce our speaker for today, is Dr. Tyler Miranda. And he, of course, is one of the therapists here. He is also a doctor of physical therapy, and I will, co-host and help him. So you'll see me around here also. And I'm going to let Dr. Tyler take it away.
The balance system. So there's three main balance systems within the body. The somatosensory system. And so when I talk about the somatosensory system, I want you to think about your feet. So the feet are going to be heavily involved with the somatosensory system. The second is the visual system, so our eyes. So again, I want you to think more about your eyes when we talk about the visual system. And then lastly is the vestibular system. So with the vestibular system, again, just to kind of make it a little bit easier, I want you to think about the vestibular system. That's where it is located. So again, just to make it a little easier, somatosensory system is your feet, visual system will be your eyes, and the vestibular system will be your ears.
I didn't hear that last one. My last one is what?
The vestibular system? Yeah. And so just in your ears. So
my ears, okay.
Yeah, located within the inner ear.
I'm on my hearing aids too. I can't complain about that.
So again, the overview of the somatosensory system. So again, I want you to think about your feet with this. And so typically it's more the skin, the muscles within our feet that are going to, again, have stimuli from, again, the floor, the ground, the surface that we're walking on. Those stimuli are going to be sent up to the brain. So again, give our brain and our body just more information about what type of surface we're walking on. Again, if it's maybe hill, an incline, a firm surface versus a compliant or a soft surface. All that information, it has to be relayed up to the brain so we can interact with the environment appropriately. And then again, have our body have the ability to maintain balance on different types of surfaces. So the second is, again, the visual system. So again, I want you to think about your eyes. And very similar to the somatosensory system, our eyes are going to send images now to our brain, again, about where we are in the environment. So again, if there's changes with our visual system, we're not able to see the environment. Again, that can lead to potential tripping, falling. So again, we need to have proper visual inputs to our brain. So again, we can interact with our environment to avoid any tripping, falling, or balance issues. And then third is, again, the vestibular system. So again, with this system, I want you to think about your ears. So this system provides information to the brain about the head's position in space. And so the vestibular system is most active, or going to only be active, when the head is actually moving or changing position. And that is to help keep, again, our head and body kind of stabilized as we're moving. So with the vestibular system, again, it's heavily involved with balance. And there can, again, be some type of atrophy or disuse. So again, we're not moving as often as we were or changing our head position as often as we were. There can be changes within the vestibular system itself that, again, might cause some balance issues. There's also a more specific common dysfunction with the vestibular system called BPPV, benign proximal positional vertigo. And again, we will touch on that a little bit later as well. But I just wanted to introduce that because that is typically more associated with the sense of vertigo or the room spinning sensation. And with that, again, I'll get into it a little bit more later, but there are crystals within our vestibular system that if they are kind of knocked loose or kind of start to float freely within the inner ear, those crystals can cause mismatch or false signals to our brain that our brain thinks we're moving when we're really not, and that's what kind of causes those vertigo symptoms. So again, there could be a dysfunction with the vestibular system where it's just not working efficiently enough. That can cause balance issues, or there can be an actual change within the vestibular system that causes more specifically the vertigo. So again, depending on why the vestibular system is not working properly, there's going to be different treatment approaches for each individual case. Okay. So I'm gonna have you kind of just go through the list yourself, but I'm gonna also read some of these questions aloud. And if you, again, feel or have experienced any of these symptoms, I'll have you raise your hand. So again, feeling of unsteadiness, losing your balance. Anyone get the room is spinning sensation?
If I get up too quick.
Too quickly, yeah. Anyone have falls or, felt like they were gonna fall? Any lightheadedness? I believe a few agree on that said lightheadedness. Any changes in vision? Anyone have any recent changes in vision? Blurred vision, or maybe not seeing depth colors, as easily as well. So all of these things can again be associated and cause balance issues. Then I know someone was mentioning, right? So again, kind of being able to accurately describe the symptoms is very important. I know a lot of patients oftentimes just say they're dizzy when they come in, and what they are feeling is probably dizziness, yes, but if we can kind of have a little bit better descriptor of words of what is actually going on or what patients are experiencing, can also again help us really, kind of narrow down which system is dysfunctional and where we need to address. So again, these four, so we'll start with vertigo, right? Vertigo is associated with a room spinning sensation. So again, although you're not actually moving, you feel as if the room is kind of spinning around you. And that would be more, again, along the lines of vertigo. And vertigo is a specific dysfunction of the vestibular system. So again, if you are experiencing this room is spinning sensation, oftentimes it's going to be attributed to the vestibular system. And most of the time it's attributed to the BPPV, although there are other conditions that can cause that sensation. A second is disequilibrium. So this is more a feeling of being off balanced or unsteady on your feet. With disequilibrium, so again, this can be potential changes or dysfunctions with the somatosensory system. It can also be due to just weakness. If someone becomes more sedentary and they're not, as active as they were, and they start to have some weakness within their muscles, that can also cause some disequilibrium. So again, we want to test all the balance systems, but we also want to take it a step further and address any other, weaknesses within the body that could potentially cause it. Balance dysfunction. Third would be lightheadedness, so more of a woozy feeling. I would say this is oftentimes associated with changes in blood pressure. We have, a lot of times patients coming in with low blood pressure or on blood pressure medications. Those things can also cause lightheadedness or dizziness symptoms as well. And I would relate that to the last one, so pre-syncope. So a feeling of you're about to faint or pass out. I would say those are kind of interrelated with the lightheadedness, and again, oftentimes associated with potential changes in blood pressure. Specifically, when the blood pressure drops too low, we kind of have that feeling that we're going to, again, pass out.
I have a question. I am often banging into walls, misjudging my space. Is that just equilibrium? Because I see it fine, I just misjudge and step the wrong way. Sort of.
There are some other words like dyspepsia, so having trouble, like you said, determining the distance between how far something is away from you. One, because you might have if you have off balance or disequilibrium, if you feel like you're wobbling and bouncing into walls, that would be more disequilibrium.
Not that.
If it's more just judging, it could be like a coordination issue.
Yeah, that's what it feels like.
And judging kind of depth perception. So that would be a little bit different, but could also still be addressed again with physical therapy. Again, the cerebellum is just a little bit whole separate topic, is more kind of connected with those types of dysfunctions, like dysmetria. So again, judging distance, coordination issues, things like that. But again, all things that can be tested and screened, through physical therapy and still be addressed appropriately with physical therapy as well. But very good question. Okay, so is your dizziness or vertigo reproducible? So I just listed here for everyone just some common activities where dizziness and vertigo kind of arise. I would say number one is usually the rolling over in bed is one of the most typical ones. Turning or looking out windows while you're driving, tipping the head back. So if you're going to go and wash your hair or wash, soap out of your hair and tipping your head back can cause it. The opposite end, kind of bending forward, dipping the head down when tying your shoes. And then, kind of an all-encompassing blanket, statement of pretty much any activity that involves you turning your head that provokes dizziness is again more along the lines of a vestibular type dysfunction. I know several of us are kind of rolling over in bed. What about any of these other activities that are listed, or does anyone experience any type of dizziness or vertigo with something different?
Change of seasons.
Okay.
Change of seasons. Change of seasons.
Yeah. Is that with every season, or
Just about.
Yeah.
Yeah, just about. I mean, now, like I said, a couple weeks ago, I just had a week of, and that was when it started to get warmer and that's one thing I chalk it up to.
And would you say like with each season change, like is it kind of just like
A snow, like when
a
snow
couple days,
starts,
a few weeks,
I've got a week of vertigo.
and then it goes away after
I'll
about a
go away, except for that trip to Europe,
week, so you're
which I still did.
right.
Because that was a long bout. Ask Jane. Jane.
And then does anyone have any specific, activities, remedies, or, what do you find that you typically try to do to decrease the symptoms when they do come on?
What do I do?
Yeah.
Oh,
to
I
try
do
to-
that exercise that I was for.
To make that, okay,
And that works.
Mhm.
Not as well as it used to, but
but it works,
to move those crystals or whatever.
right, yep. So how is everyone going to manage the dizziness and vertigo? So oftentimes, I would say people tend to ignore it, especially when it first starts to occur. Oftentimes, people think, just as as we're aging, as we're getting older, these are just some normal things that occur. Who here would say that they've ignored it? Whether it's been for weeks, months, maybe years, and that's very, very common. Everyone thinks it's normal, and you can live with it, and you kind of manage, which we'll go to the second one. So self-management. So this can kind of, I see broken down in two different ways. One, I would say self-manage, almost leading into the medication aspect, whether over the counter or from a doctor. But oftentimes I see patients that self-manage by just avoiding activities, avoiding certain positions or triggers, that are giving them the symptoms. Would anyone kind of agree with that they maybe modify their life or avoid certain activities that cause their symptoms? So again, very, very common. 3 would be, again, that medication. So this could again be whether it's over the counter or prescribed, meclizine, or things that help suppress the body and the systems to reduce dizziness and vertigo. Has anyone ever tried any medication, whether over the counter or prescribed, for their dizziness issue?
But I can't remember what it was. Like a Dramamine or something?
Yeah, Dramamine.
Put me to
another one.
sleep for a
Yeah,
whole day and
yeah.
then did it again.
Yeah. And so again, we want to try to avoid these medications because again, they can have side effects that, great at getting rid of your dizziness, but you can't get out of bed because
Yeah,
you're
right.
sleeping the whole day.
There's a little roll-on thing. It's so natural. I don't
Oh,
know what's
behind
in
your
it. You put it behind your ear.
Okay, I've seen, I'm not sure the name.
A vertigo less or vertigo. Has the word vertigo.
Vertigo, yeah. So yeah, so very, very common. And again, these medications can help short term in terms of masking symptoms, but ultimately it's not addressing the underlying reason or cause. So again, it might give you some temporary relief, but we, again, here at Physical Therapy, we want to address the underlying reason and cause you're getting your symptoms, and treat it so that, hopefully it doesn't come back, or we can at least improve the symptoms rather than just masking the symptoms that you're experiencing. And then I would say everyone officially, falls into number 4 today. So everyone has, chose to seek out treatment and professional help by coming to this workshop and learning a little bit more. So, I'll applaud all of you for, taking that first step to, coming to a workshop and learning a bit more, and hopefully, again, seeking out treatment for the condition and the symptoms that you've been going through. So we got 5 common causes of vertigo and dizziness. I'm just going to briefly touch on them here because we're going to dive a little bit further as we go into the PowerPoint. So one is medication. Just side effects from common medications that you may be taking could be causing some dizziness and balance issues. 2 is orthostatic hypotension. This is related specifically to blood pressure and a change or a sudden drop in blood pressure. 3 is cervicogenic origin. Big fancy word. Really what it boils down to is there's dysfunction within the cervical spine, within your neck, within the muscles and within the joints of the neck that can be causing not only pain, but dizziness symptoms. 4 is BPPV. So again, this is benign paroxysmal positional vertigo. We will dive a little bit further. This is again a dysfunction within the vestibular system itself due to crystals that have been kind of misplaced and causing the BPP or vertigo symptoms. And lastly is actually COVID-19. So a lot of studies are coming out saying that dizziness is a very common side effect, both when COVID-19 is actively active in a person and even after it runs its course. Dizziness is a side effect. So there is some new research coming out, stating how physical therapy and vestibular rehab can help with patients that are suffering from dizziness from COVID. So again, going to go a little bit more in depth. So medication. So a lot of common medications that are prescribed or even over the counter can produce dizziness as a side effect. So anyone that might be on antihypertensive, so blood pressure medications, very common side effect with blood pressure medications, especially if you're recently put on or maybe have had a change within the medication that you're taking. So one thing, we always screen when patients come in is their medication list, because again, it might not always be something, more sinister, so to speak. It might not be an actual dysfunction within your body. It might just be a medication that you're taking. So, anyone here is on blood pressure medications, if you're taking ibuprofen or over-the-counter anti-inflammatories, or even prescribed anti-inflammatories, or pain medications, Percocet, oxycodone, things like that. So, we have patients come in for other injuries that they're taking pain meds for. And if they're experiencing some dizziness, again, we want to shed light on the potential side effects of medications they've been taking that could be causing it. Muscle relaxers and mood stabilizers are all medications that could potentially be causing dizziness. So, if you've started taking some medication recently, or maybe you've been taking it a while, but you're experiencing some dizziness, I would recommend potentially talking to your, primary care physician about, these symptoms you're experiencing as a potential side effect from the medication. Second, so orthostatic hypotension. So again, this is related and it's a form of low blood pressure. It typically happens when you change position. So if you sit up too quickly from a lying down position, or even going from a sitting position to a standing position very quickly and rapidly, there could be a sudden drop in your blood pressure, causing, again, a feeling of dizziness, lightheadedness, and just kind of feeling off. And so again, this is a condition that we can screen for, at physical therapy, and kind of test and see how your blood pressure reacts when you do change position, because there are some remedies and some different exercises we can do to help offset or decrease that sensation, feeling lightheaded, after sitting up or changing position too quickly as well. Anyone find that when they kind of sit up too quickly or come up too quickly, they feel a little off? Yeah.
I'm put on the medication to raise my blood pressure.
Okay.
And my doctor really had to look it up. He's like, I never prescribed this, but it didn't seem to make a difference. So.
Okay. Was that specifically for doing that, or you had this chronically low blood pressure and then they wanted to?
Because I was, it was really, I had very low
Very low blood pressure. Yeah. Again, there are some ways and some exercises that we can do, to again try to offset or decrease that sudden drop from sitting up too quickly. So next is going to be again the neck pain or dysfunction. So again, typically with this, patients will have neck pain associated with dizziness. Oftentimes when they turn their head or change their head position, they're going to get not only the pain, but the dizziness that's associated with it. Oftentimes they'll complain of neck pain, neck stiffness, and it's actually caused by dysfunction within the neck itself, both within the joints within our neck and the muscles. And similar to how our feet send signals to our brain about its position, same thing with our neck. There's signals that are sent from our neck to let our brain know, again, where our head and body is in its space. And so if anyone finds that they're getting neck pain and dizziness at the same time, again, you might be more categorized in this cervicogenic origin of your dizziness. And again, specific treatments to work on the neck itself will also help with the dizziness. Anyone have neck pain with dizziness?
No.
Okay.
It's part of my body, it's just not. We'll get it figured out.
That's it. Okay, so next is the BPPV. Again, this is benign, so it's non-life threatening. It's paroxysmal, which means it comes on in short episodes. It's positional, again, typically associated with changes with head position, turning the head. And then vertigo is that specific sensation of the room is spinning. Again, BPPV is the most common cause of the vertigo symptom or sensation. And the hallmark sign is, it's called nystagmus, but it's uncontrolled rapid eye movements. And I'm going to play a short little video, which again is going to kind of describe how these crystals can break loose and they get trapped within the vestibular system. And because these free-floating crystals are now within the vestibular system, they're going to, again, cause our brain to think we're moving when we're actually not. And you'll actually see on the little video, the eyes kind of actually spinning and moving, which is again the hallmark sign. Might be a little.
Normally, only with head movement does fluid within the inner ear also move, informing the brain that a head turn occurred. However, should a crystal called an otolith gets displaced into the posterior canal of the inner ear, BPPV dizziness occurs. Fluid movement occurs due to the crystal rather than head turns, causing the brain to think movement has occurred, even though none has happened.
That was scary.
The Evelyn maneuver is performed to treat.
So I found that sometimes patients actually, if they keep their eyes open, they can kind of notice that their eyes are spinning. I find also that a lot of times patients kind of get scared and freaked out, so they shut their eyes, and so they don't really know what's going on, but they just feel the sense of spinning.
I never knew that your eyes spin.
Yeah, and so that's
But I close my eyes, I know I do.
and so that's a very common common response with patients. Some notice and some don't. So I don't want to say that if you don't notice it, it's
Remove
not.
crystals, how do we do that? That's what I want, get rid of those crystals. How do you do
Well,
that?
you need the crystals, but we can put the crystals
You don't
back
wanna
into
get
their
rid of them.
spot.
Oh, I don't?
Their
I
place.
You just want them in the right
Hey,
place.
that's what's causing you to go,
You want to make sure they're in the right place.
okay, I'll get them in the right place.
And then lastly is, so again, the COVID-19. So vertigo and dizziness has recently been described as, again, an emerging and a very common side effect of the COVID-19 virus. And it's just, again, being found more and more that this is a very common symptom, both when it's active within the body and even after. And so early research studies, again, obviously this is, fairly new. It's only been within the last year, but early research studies are indicating and showing that vestibular rehabilitation therapy, again, in physical therapy, but the vestibular rehab can show promising results and have a positive impact on the dizziness associated with having, again, even COVID-19. So, maybe not necessarily for you, but maybe someone that has, had COVID in the past and has had dizziness associated with it. Again, just informing them and, kind of continuing the education train and, letting them know that physical therapy can, be a very, very good rehab option for them if they are still experiencing some dizziness associated with having the COVID-19. So managing your dizziness and vertigo. So again, with physical therapy, we want to fix and address the underlying cause of your dizziness and vertigo rather than just masking them. So what would the first visit at physical therapy kind of entail? So ultimately, again, we want to really listen to your story and what's been going on. One, because not only will it let us know and allow us to gather more information about what system and what's potentially dysfunctional, but again, we want to know what is this, what has it been limiting you from doing? oftentimes people come in and patients come in and say they can't play with their grandkids anymore because they're on the floor and they, they can't go down to pick them up, and, So we want to know what is kind of, the driving force for you to obviously get this fixed, and kind of what functions you've been, having difficulty performing to kind of get you back on your feet. No joke, no pun intended. But get you back on your feet and, able to do the things that you want to do. Again, we're going to have to examine your vision. Again, that's very heavily involved as one of the balance systems. Your balance of the somatosensory system. And again, sometimes it could be just some strength and range of motion issues. If you're having some weakness from being sedentary, or again, you're not moving as well through your hips, your back, or your joints. All of those things can also play a role in why someone might be off balance. So, we will screen all the balance systems, but then we will also, look at the musculoskeletal system to make sure everything is functioning well and in unison, to again address all of the underlying causes and reasons. We're going to evaluate all the findings from the examination to again determine which specific system or systems may be dysfunctional. So again, all of these systems work in unison and combination. One doesn't necessarily work in isolation of the others. And so we want to make sure we address, again, whether it's maybe one system or multiple systems that may be causing the vertigo, dizziness, or balance issues. All right. And then lastly, again, we're going to create a unique plan of care individual to you. So not every person is going to have the same dysfunctions. Not every person is going to have the same involvement with these systems. And so again, creating that unique individual plan to where we're addressing each system appropriately is going to ultimately lead to the success for managing the symptoms you're experiencing. What else will we check? So again, posture. Oftentimes this is more related with patients that have the cervicogenic or the neck component involved. So poor posture can definitely be related to changes in neck position and the joints and the muscles within the neck. Again, your function. So what are you not able to do that you would like to do? Whether it's as simple as just walking down the street without losing your balance, or something a little bit more high level, stairs. Looking at how you're being kind of affected and how your function's being affected because of your symptoms. Again, we're going to look at all the balance systems, the vestibular system, the visual system, and the somatosensory system. And again, the cervical spine, because that is, again, can be heavily related if you're having neck pain and dizziness at the same time. We want to, again, address all possible areas that may be causing your dysfunction. And so each of these, so the plan of care is, again, going to be individualized to yourself. So if you are someone that has the cervicogenic or the neck origin of your dizziness, we're going to have to use more manual therapy involving like soft tissue mobilizations and joint mobilizations to get, again, the neck working appropriately. If you're having more of the BPPV type symptoms, we'll use repositioning maneuvers. So again, because those crystals are out of place, we need to kind of get the crystals back to where they're supposed to be to decrease or to remediate the vertigo symptoms. And so repositioning techniques, and I actually have a video of me performing one of them on a patient that came in for his vertigo symptoms. And as you can see in the video, we're changing from one lying down position. And with this one specifically, we just come up and over rapidly to the other side. So there are different repositioning techniques. And again, whatever you're kind of experiencing, and depending on where that crystal is located, there's different repositioning techniques. So this is just one of a few that we have.
How do you know where the crystals are?
So that's again based on the symptoms that you're experiencing, and there's some testing, positional testing that we can do to determine which canal the crystals are in, and then depending where the which canal the crystal is in, there's different repositioning techniques for each individual canal. And so with this gentleman, actually the first repositioning technique we used, it wasn't very successful on him, so we tried the second one, and then within a few sessions, he was gone, cured. So again, there are different techniques, and so we got to find again one that's most appropriately, for you and where the crystal may be displaced, in your situation. Another one, so other techniques is habituation, which is typically kind of just going into provoking positions to kind of have the body adjust or get used to feeling those symptoms. So oftentimes where you're kind of lying down back and forth, it's, it sounds like you were doing more habituation with some of your symptoms to kind of reduce the overall severity of what you were feeling. So therapeutic exercise. So again, we will be testing the musculoskeletal system. So if it's more just weakness that's been kind of going on and we're contributing to the balance dysfunction, just doing some strengthening and stretching exercises again to reduce the effects of weakness within the body, especially in our legs and our glutes, that could potentially be causing some balance issues. And lastly would be modifying the environment. So oftentimes visual changes is something we can't necessarily change, without obviously glasses or things like that, but being able to modify your environment so that it's more safe. So again, if you're having difficulty with your vision, maybe having, contrasting colors on the stairs, or, reducing maybe throw rugs which could be a potential tripping hazard. So oftentimes we obviously want to treat the underlying cause, but in terms of vision, if it's not something we can directly impact, we want to modify the environment just to, again, make it more safe, to avoid any falls or tripping hazards. And so again, this is that same patient. Before he came to PT, same thing, he went to his ENT, was diagnosed with vertigo, was basically on his floor and unable to move or get up for quite a few days, just very nauseous, getting sick a lot. And after physical therapy, he was able to do quite a few things. And so this is just one exercise that we were doing. So again, anytime you're changing your head position, you're moving your head, whether it's up and down, side to side, you're activating and stimulating the vestibular system. And so this is just one of the few exercises or many exercises that we can do to just specifically train and work the vestibular system. And so, this patient went from, again, not being able to even leave the floor. You pretty much had to just stay on the floor, anytime he got up, severe vertigo, severe nausea and vomiting. And then after, about 5-6 treatments and some repositioning techniques and exercises, he was, well, you saw he was, moving his head, throwing the ball up and down, and kind of got back to life. He wasn't able to drive. So it was very, very severe. But again, just with some repositioning techniques and some exercises, we were able to get him back on his feet. And so again, being proactive. So seeking treatment that gives you long-term relief. Again, we want to try to avoid medications if possible, because again, those are only really just masking the symptoms. And typically, I would say, the earlier you kind of get treatment or seek treatment, the faster the outcomes will be. Oftentimes when we delay things, we kind of push it to the side in the back burner, the symptoms kind of manifest and get worse and worse and worse. And then ultimately, the worse that they get, the longer it can take to kind of treat them. So again, kind of nip it in the bud, so to speak, before they get, too bad, or before, again, maybe some of this imbalance can potentially, cause a fall, which would lead to obviously much further complications with a potential fall. So what to do next? So again, if anyone is interested, we can kind of get you signed up and set up for, whether a screen right here in the clinic now. Because again, we want to have you guys address this hopefully sooner than later, and kind of take charge. You've taken the first step coming in today, to get some information about it. But really, we want to hopefully see you guys make the change and, take the next step forward to kind of.
If we want to go on and go through, do we need a prescription from the doctor?
So no. So that is actually part of the frequently asked questions. So with physical therapy, no, you don't need a prescription from your doctor. Typically we'll have you come in and we'll do the screen or do the evaluation. We will ask, that you provide, primary care or someone that you're comfortable with that we can kind of communicate with. But to come in and to kind of get set up with the first appointment, you don't need a doctor's appointment.
I'm on Medicare, so I mean, if I have a prescription, then they pay for it.
Correct. Yeah. So what would happen is if you're on Medicare and you came in without a prescription, like I said, we would just ask that you provide, maybe a primary care physician or someone that you have a very good relationship with, and we can do the full evaluation and have that sent out to the doctor. And as long as they sign off on the plan of care that we established, that would be the same as having a prescription. And so it would kind of, you don't have to necessarily go to the doctor first to come in. We can kind of have you kind of go through that part without going there first, and we'd be able to see you, even without the prescription, and get you started.
And if it's not Medicare, that's the case for Medicare. If it's not Medicare, you don't really need a prescription to get ongoing physical therapy treatment.
Yeah, I mean, do you want me to do a demonstration or we can do a light demonstration, or again, if anyone is interested, you can get kind of signed up and do some screens and kind of see again what's been going on, and
That one's a screen pick.
30 minutes, 45 minutes.
Back to work.
Crazy good.
You have the script, yeah.
I was at my doctor's last week.
Okay. So, yeah, we could, we could do a demonstration.
This was excellent. Thank you.
Oh,
Yeah,
thank
it was
you.
very
interesting.
Thank you for coming.
Yeah.
Crystals, those crystals drive me crazy. But I'm supposed to have them, so I guess I better.
Yeah.
Yeah, we don't want to get rid of them yet.
They're in the way.
What are they exactly? What are they made of? I mean, is it just? Is it like calcium? or-
Calcium, yeah.
Yeah.
Yep. Like I said, unfortunately, you do need them, and we don't want to get rid of them. But again, with proper repositioning techniques and getting them back to again where it's supposed to be.
So that's what I was told. That's the.
So we could quickly, does anybody have any specific questions, or we could just go through the frequently asked questions and hopefully that will address. Somebody already asked that, so one of them about the prescription.
So one is, you can't just do exercises at home. Again, the exercises, especially with more of the vestibular rehab and the vertigo, the exercises with that are more again like follow-up to retrain the vestibular system and the reflexes within our vestibular system. But again, if you're experiencing vertigo specifically, just the exercises are not going to, again, treat the underlying cause of the crystals being out of position. So you really need to come in to get, again, the crystals to be replaced or put back into where they're supposed to be. Exercises alone aren't just going to fix that for you. And same thing with just exercises. General exercises aren't going to really be much of a long-term benefit if you're not addressing the specific balance system that's dysfunctional. So kind of you need a more guided and prescribed exercise list rather than just general strengthening, so to speak. We will give home exercise program as part of therapy, so you will have exercises to take home, but again, it needs to be a little bit more specific to your dysfunction and what's going on. Divertigo, is that maybe the medication? So again, the medication is going to just treat the symptoms, but it's not going to address the underlying cause. And so again, maybe early on they might help, but typically the symptoms end up coming back because it's only addressing the symptoms, but not the reason why you're experiencing, again, whether it's the dizziness, balance, or vertigo symptoms. And then lastly, the question that was asked, so again, you don't need to see a doctor first. We will collaborate with your primary care physician. And ultimately, as long as they sign off, you don't need to see the doctor first. You can come right to physical therapy and get an evaluation done.
Again, just to clarify, that is the case with Medicare. You need that plan of care. Even if you have a prescription, you have to do the evaluation and have that plan of care.
Before I get the.
Well, for you to continue ongoing treatment, but you could have the evaluation without seeing the doctor.
I just don't want, if I do decide, I don't want to have to pay for it.
Right, so that's, so you would need to give us the primary care physician's name or the specialist, whoever you're seeing that you want.
I got one more question, but it's not, I run a senior center. I mean, would you be willing to do a workshop down there?
Which senior center?
Bloomingdale.
Okay.
It's a small center, and I am opening slightly. The reason I have to go back, I have a yoga class, so I gotta open the building. Right now.
Okay, yeah, sure, you have a card or just leave us your information and we will.
Not sure I have a card with me, but.
Okay, yeah, we'll just take your information and, we'll be in touch.
All right, sounds like a plan.
Okay, so,
This is my best friend Sharon. I nominate Sharon. For what? To do what? What are you gonna do? I'll go. What are you gonna do?
It's just a simple kind of demonstration. So it's kind of just to go
Oh,
through and show you
demonstrate
kind of
something.
the
Yeah,
different.
but I definitely do. I'm gonna sign up. I'm not gonna say I
Sorry.
didn't do it, but I'm
yeah,
gonna do
that's,
it.
Yeah.
I got my prescription and everything.
Yes.
You wanna
We'll
do,
get to
wanna go
sign.
in front or want me to?
Oh, what do you want?
You're gonna be like,
You're gonna be the model.
Yes. So we're just gonna test kind of some
I
of the
could take this
balance,
off.
balance systems.
I've got my shots on.
So, I mean, I could just, let's bring feet together. So we're just gonna test, so, it's kind of interesting, so some of the testing that we do or screening that we do is it's actually very similar to the field sobriety test. And the reason being with the field sobriety test, so your vestibular system actually becomes impaired when under the influence of alcohol. So the field sobriety test actually kind of looks at, I'm not saying that you are.
I might go for that.
But again, so they're actually kind of testing and looking at the different balance systems to see, again, if you're potentially under the influence because the vestibular system is affected. So first, I'm gonna actually have you just standing with feet together and not touching.
I know.
There we go. Seems pretty easy, not too bad, right?
No, I feel good.
And so again, with the somatosensory system, if we change our base of support, so again, the wider our feet are, the easier it's gonna be to
Yeah, I
balance,
would like
right?
to have them.
The narrow, so let's try to do like a tandem stance, so 1 foot in front of the other. Take balance here. Feel a little more wobbly or?
Yeah, I do.
A little bit?
Yeah.
Okay. All right, so let's bring feet back apart and just feet together again. And so now we're gonna change or influence a different system. So I'm actually have you try to close your eyes and maintain balance. And so with this, we're now taking away vision. So the other two systems have to kind of be even a little bit more on high alert or involved to maintain your balance. Okay, not too bad. Very good,
I
actually.
can feel myself.
All right, so let's open eyes. Let's go back into the tandem feet position. And I'll be spotting you. And let's try to close eyes. Yep. Still pretty good. But again, you can kind of see how it starts to sway a little bit more. And so these are just, some of the soft screens that we'll do, but there are several others. But to again, just to kind of see and which balance system might be potentially impaired. And so again,
Yeah, that's really
Yeah.
cool. I like that.
you're pretty good though. Pretty
Okay.
good. And so again, this would be more for someone that's feeling imbalanced, unsteady on their feet. This wouldn't be more specific to the vestibular or the vertigo symptoms. So again, there are different treatments for depending on what's going on, right? So if it's more the balance, we're going to address the somatosensory, the visual, and the vestibular system with exercises, different types of balancing techniques. Again, changes in ankle position, hip position. So we're gonna be strengthening those to again improve your balance. If you're getting more vertigo type symptoms, room is spinning, those again are more with the repositioning techniques and followed up with more specific exercises to retrain the vestibular system due to the vertigo. So again, just wanted to give a quick demonstration of how each individual system can be affected or causing imbalance. Very good. Thank you.
See, there's something wrong here.
Did very well, though. You did very well.
I'm interested in what you said, but I'll talk to you.
Okay.
Okay. You're very informative. Thank you.
Thank you. Thank you for coming.
There is a survey there, please fill it up for us because we want to keep improving.
I would like to screen. I'm here, so I love it if it's